Hello everyone! Welcome to NurseNotesPH, your go-to channel for all things nursing. My name is Professor Mia, and I'm thrilled to guide you through today's topic, an introduction to nursing management concepts and theories. Whether you're a nursing student, a practicing nurse, or just curious about the field, you're in the right place. Let's dive in. Nursing management involves the coordination and oversight of nursing care, resources, and staff to ensure high-quality patient outcomes. It encompasses various responsibilities, including planning, organizing, staffing, directing, and controlling nursing activities. Planning is a fundamental component of nursing management. It involves developing strategies to meet patient care needs, setting goals, and determining the best course of action to achieve those goals. Let's break down what this entails. First, developing strategies to meet patient care needs means identifying the specific requirements of patients and creating a plan to address them. This could involve everything from ensuring adequate staffing levels to implementing new healthcare protocols or procedures. Setting goals is another critical aspect of planning. These goals need to be SMART, specific, measurable, achievable, relevant, and time-bound. For example, a goal could be to reduce patient falls by 20% over the next 6 months. Setting clear, attainable goals provides direction and benchmarks for success. Determining the best course of action involves analyzing different approaches to achieving these goals and selecting the most effective one. This requires critical thinking and the ability to anticipate potential challenges. For instance, if the goal is to improve patient satisfaction, the best course of action might include increasing nurse-patient interaction time, enhancing communication skills among staff, or implementing new patient feedback mechanisms. Effective planning also involves continuous evaluation and adjustment. As circumstances change, nursing managers must be able to reassess their plans and make necessary modifications. This dynamic process ensures that patient care remains responsive and adaptive to new information and evolving needs. In summary, planning in nursing management is about creating a roadmap for achieving high-quality patient care. It requires setting clear goals, developing strategies to meet those goals, and continuously evaluating and adjusting those plans to ensure success. Through effective planning, nursing managers can ensure that their teams are well prepared to provide the best possible care to patients. Organizing is a crucial aspect of nursing management, essential for translating plans into action. This involves structuring the nursing team and resources effectively to implement the plans. Let's delve into what organizing entails. First, structuring the nursing team involves determining the most effective way to allocate and utilize staff to meet patient care needs. This includes understanding the skills and competencies of each team member and assigning them to roles where they can be most effective. For example, more experienced nurses might be assigned to critical care areas, while less experienced nurses might work in less demanding units, with appropriate supervision and support. Creating schedules is another critical task. Effective scheduling ensures that there are enough staff members on duty at all times to meet patient care needs. This includes accounting for shift changes, vacations, and unexpected absences. A well-organized schedule helps to prevent burnout and ensures that nurses have adequate rest, which is crucial for maintaining high-quality patient care. Ensuring that the necessary resources are available is also a key part of organizing. This includes everything from medical supplies and equipment to support services and technology. For example, ensuring that there are enough IV pumps, medications, and personal protective equipment available is critical for efficient and safe patient care. It also involves making sure that nurses have access to necessary support services, such as administrative assistance and continuing education opportunities. Assigning roles is about clearly defining each team member's responsibilities. This ensures that everyone knows what is expected of them and how they contribute to the overall goals. For example, One nurse might be responsible for administering medications, another for patient education, and another for wound care. Clear role assignments help to prevent overlap and ensure that all necessary tasks are covered. Effective organizing requires constant communication and coordination. Nursing managers need to regularly check in with their teams to ensure that everyone has what they need and that any issues are promptly addressed. This also involves being flexible and ready to reassign roles or resources as situations change, such as during a sudden influx of patients or an emergency. In summary, organizing in nursing management is about creating a structured environment where plans can be effectively implemented. By creating schedules, assigning roles, and ensuring that all necessary resources are available, nursing managers can create a well-coordinated and efficient team capable of delivering high-quality patient care. This organized approach helps to ensure that the nursing team operates smoothly and that patient needs are met promptly and effectively. Staffing is a vital component of nursing management that focuses on recruiting, hiring, and retaining qualified nursing personnel. Additionally, it involves ensuring that the staff are well-trained and competent to perform their duties. Let's explore each of these aspects in detail. First, recruiting involves attracting qualified candidates to apply for nursing positions. This can be achieved through various strategies such as job postings on healthcare job boards, attending job fairs, collaborating with nursing schools, and leveraging social media platforms. Effective recruitment ensures a steady flow of potential candidates, which is crucial for maintaining adequate staffing levels. Hiring is the next step, where the selection process takes place. This involves reviewing applications, conducting interviews, and assessing candidates' qualifications and fit for the team. It's important to look for not only the necessary clinical skills but also qualities like empathy, teamwork, and adaptability. The hiring process should be thorough and structured, including reference checks and possibly practical assessments to ensure the right fit for the organization. Retaining qualified nursing personnel is equally important. Retention strategies might include offering competitive salaries and benefits, providing opportunities for career advancement, fostering a positive work environment, and recognizing and rewarding outstanding performance. High turnover rates can be costly and disruptive, so creating a supportive and engaging workplace culture is key to retaining staff. Ensuring that the staff are well-trained and competent to perform their duties is another critical aspect of staffing. This includes orientation programs. This means that new hires should undergo comprehensive orientation programs to familiarize them with the hospital's policies, procedures, and culture. Ongoing training and professional development refers to continuous education and training opportunities helping staff stay updated with the latest practices, technologies, and advancements in nursing. This could include workshops, seminars, online courses, and simulation training. Competency assessment means regular assessments and evaluations ensure that nursing staff maintain their skills and knowledge. This might involve annual reviews, peer evaluations, and skills checklists. Additionally, fostering a culture of mentorship and support is essential. Experienced nurses can provide guidance and support to newer staff, helping them to grow and develop their skills. This not only improves competency but also enhances job satisfaction and retention. In summary, staffing in nursing management is about more than just filling positions. It involves a strategic approach to recruiting, hiring, and retaining skilled nursing personnel, and ensuring that they are well-trained and competent. By focusing on these areas, nursing managers can build a strong, capable, and motivated nursing team that delivers exceptional patient care. Directing is a crucial function in nursing management that involves guiding and leading the nursing team. Effective directing ensures that the team works cohesively towards common goals, maintains high morale, and provides consistent, high-quality patient care. Let's break down what directing entails. First, guiding and leading the nursing team involves setting a clear vision and providing direction on how to achieve it. This means being a role model and demonstrating the behaviors and attitudes expected from the team. Leaders must be visible, approachable, and supportive, fostering an environment where team members feel valued and motivated. Providing instructions is a key part of directing. This includes giving clear, concise, and actionable directives to the nursing staff. Instructions should be specific and understandable, ensuring that everyone knows their roles and responsibilities. Effective communication is essential here. Nursing managers need to convey expectations, provide feedback, and ensure that all team members are on the same page. Maintaining morale is another critical aspect. High morale leads to increased job satisfaction, better teamwork, and improved patient care. To maintain morale, nursing managers should recognize and reward good performance, provide opportunities for professional development, and address any issues or concerns promptly. Creating a positive work environment where nurses feel supported and appreciated is vital. Ensuring team cohesion means fostering a collaborative and cooperative team environment. This involves promoting teamwork and encouraging open communication among team members. Nursing managers should work to resolve conflicts quickly and fairly, ensuring that any issues do not disrupt the team's harmony. Team-building activities and regular meetings can help strengthen relationships and improve collaboration. Directing also includes setting goals and monitoring progress. Nursing managers need to establish clear, achievable objectives for the team and regularly assess progress towards these goals. This helps keep the team focused and motivated, ensuring that everyone is working towards the same outcomes. Motivating the team is also crucial. Motivation can be achieved through various means, such as providing opportunities for career advancement, offering incentives, and creating a supportive work environment. Understanding what drives each team member and leveraging that can help keep the team engaged and committed. In summary, directing in nursing management is about providing leadership and guidance to the nursing team. It involves giving clear instructions, maintaining high morale, fostering team cohesion, and motivating staff to achieve common goals. Effective directing ensures that the nursing team operates smoothly and efficiently, leading to better patient outcomes and a positive work environment. By mastering the art of directing, nursing managers can inspire their teams to deliver the highest standards of patient care. Controlling is a vital function in nursing management that involves monitoring and evaluating the performance of nursing care. This ensures that the standards of care are met and allows for necessary adjustments to improve performance. Let's explore what this entails in detail. First, monitoring the performance of nursing care involves keeping a close watch on all aspects of patient care to ensure that it meets the established standards. This can be done through various methods such as regular rounds, audits, and reviewing patient records. Monitoring helps identify any deviations from the expected care processes and outcomes. Evaluating performance is about assessing the quality and effectiveness of nursing care. This involves analyzing data collected during the monitoring phase, such as patient outcomes, compliance with care protocols, and feedback from patients and staff. Evaluation helps in understanding how well the nursing team is performing and where there might be areas for improvement. Ensuring that the standards of care are met is central to the controlling function. Standards of care are the benchmarks for measuring the quality and safety of patient care. These standards can be set by healthcare institutions, professional organizations, or regulatory bodies. Nursing managers need to ensure that these standards are consistently upheld to provide high-quality patient care and to comply with legal and ethical obligations. Making necessary adjustments to improve performance involves taking corrective actions based on the evaluation findings. This could mean implementing new policies, providing additional training, reallocating resources, or revising procedures. For instance, if patient satisfaction scores are low, a nursing manager might introduce new communication training for staff or modify patient interaction protocols. Feedback mechanisms are crucial in the controlling process. Regular feedback from patients, family members, and healthcare staff provides valuable insights into the quality of care. This feedback helps in identifying strengths and areas for improvement. Nursing managers should establish effective channels for collecting and responding to feedback. Performance appraisals are another key component. Regular evaluations of individual and team performance help in identifying top performers and those who might need additional support or training. Appraisals should be fair, objective, and constructive, focusing on both achievements and areas needing improvement. Nursing managers should foster a culture of continuous improvement, encouraging staff to seek ways to enhance care quality and efficiency. This can be supported through initiatives like quality improvement projects, professional development programs, and adopting evidence-based practices. In summary, controlling in nursing management is about ensuring that nursing care meets established standards and making necessary adjustments to enhance performance. By effectively monitoring and evaluating care, nursing managers can identify areas for improvement, implement corrective actions, and ensure that patients receive the highest quality of care. This continuous oversight and adjustment process is crucial for maintaining excellence in nursing practice and achieving optimal patient outcomes. In conclusion, the essential functions of nursing management, planning, organizing, staffing, directing, and controlling, are integral to delivering high-quality patient care. Effective planning provides a strategic roadmap for meeting patient needs. Organizing ensures that resources and roles are well structured. Staffing focuses on building a competent and motivated nursing team. Directing guides and inspires the team to work cohesively towards common goals. And controlling ensures that care standards are consistently met and improved upon. By mastering these functions, nursing managers can create an environment where patient care is responsive, efficient, and continuously improving. Through strategic planning, structured organizing, thoughtful staffing, inspirational directing, and rigorous controlling, nursing leaders can ensure their teams are well prepared to provide the best possible care to patients. Thank you for joining us in this exploration of nursing management. Remember, effective leadership in nursing is key to achieving excellence in patient care. If you found this information valuable, don't forget to like, share, and subscribe for more insights on nursing and healthcare management. Together, let's strive for excellence in nursing practice.